When a participant enters a clinical trial with a therapy or an intervention, and let's use pharmaceuticals as an example, anytime they experience an event that leads them to die or is life-threatening, requires them to seek immediate medical attention, causes a congenital anomaly, requires them to be hospitalized, prolongs their hospitalization, or causes permanent disability, that's categorized as a serious adverse event. It's important to know in each group how many people have a really bad event, i.e. at least one serious adverse event. So then at the end of a trial, you can determine, depending on the intervention that they received, who's at risk for overall harm or net detrimental effect.
You're really looking for the net effect. You want to see what the effect of the drug was, the good effects,
yeah.
But you also want to know how that's balanced against the bad effects. Sometimes the bad effects are not found in the published trials.
One, serious adverse events are not reported in the published manuscript in medical journals. Two, they're reported, but in a way that is inappropriate. Three, they're reported appropriately or inappropriately, but not enough emphasis is placed on the interpretation of this very useful information. And four, they're reported, maybe interpreted correctly or incorrectly, but there's strong suspicion or confirmation that the serious adverse event data does not contain all that occurred to patients that, by definition, are serious adverse events. So I'll give you an example. Dabigatran's been studied for another population, specifically patients undergoing total knee replacement. What they were doing was to see if dabigatran versus the comparator drug prevented the formation of what we call VTEs, venous thromboembolisms, so either a clot in the lungs or a clot in the legs. Both of those types of clots are by definition serious adverse events. Because the primary outcome in those studies was a measure that included VTEs or clots, they arbitrarily decided to take out the VTE data from the serious adverse event data, even though by definition those events were serious adverse events. Right. It is selectively calling some things serious adverse events when they report the data, when in fact they should be reporting all events that by definition are serious adverse events together. Under the Good Clinical Practice Guidelines or the Declaration of Helsinki, that there are standardized definitions for serious adverse events. There are rules regarding the conduct of a clinical trial and recording serious adverse events. There are no rules or laws surrounding the reporting in published reports of clinical trials of serious adverse events. I know they have the data, it's just they're not reporting it, or they're not reporting it in a way that's interpretable. When it comes to the health of a patient or the potential for someone to make a decision about their therapy, and they're not finding out the potential for harm for a therapy, then we've got a big public health issue on our hands. It's a different ballgame.